Hello, everyone. My name is Raul Melendez, and this is MPA570. Today, I will be presenting my policy analysis on homelessness in the city of Ontario, California. Here is an overview of this presentation. I will begin with the problem analysis using point-in-time data to establish the measurable scope of homelessness in the city of Ontario, California, while incorporating San Bernardino County data to provide regional context. I will then identify key stakeholders, review three policy alternatives, and conclude with an evaluation matrix and recommendation grounded in effectiveness, fiscal feasibility, political feasibility, and long-term sustainability. According to the San Bernardino County Homelessness Partnership, the annual point-in-time count is conducted each January and is required by the United States Department of Housing and Urban Development. In 2024, 4,255 individuals were counted countywide. In 2025, that number declined to 3,837 individuals, representing a 9.8% decrease. However, 2,636 individuals remain unsheltered. Within the city of Ontario, 297 individuals were documented as experiencing homelessness. While the most recent data indicates measurable progress, the continued presence of a substantial unsheltered population reflects structural housing affordability pressures and limited production of affordable housing. These figures demonstrate that homelessness remains a measurable and ongoing municipal concern. Individuals experiencing homelessness are the primary stakeholders directly affected by municipal housing policy. The Ontario City Council serves as a key institutional stakeholder responsible for budget authorization, land use decision, and oversight of housing policy implementation. The Housing Services Division administers federal housing programs and coordinates local implementation. Nonprofit housing advocacy organizations such as the National Alliance to End Homelessness and the California Housing Partnership Corporation promote housing first strategies and expansion of deeply affordable housing. Civil rights organizations such as the American Civil Liberties Union support housing center responses and protections for individuals experiencing homelessness. Healthcare systems partners such as Inland Empire Health Plan also play a role in coordinating Medi-Cal services and supportive care for individuals experiencing homelessness, particularly within permanent supportive housing models. Conversely, in the industry and taxpayer advocacy organizations also shape the policy environment. The California Apartment Association advocates regulatory stability in private sector housing development, while the Howard Jarvis Taxpayers Association emphasizes fiscal restraint and limitations on public expenditures. These differing perspectives directly influence political feasibility and implementation strategy. The first alternative maintains the existing framework under the McKinney-Vento Homelessness Assistance Act of 1987. The housing related components of this federal law are administered by the United States Department of Housing and Urban Development. Through programs such as the Continuum of Care Program and the Emergency Solutions Grant Program, federal funding supports outreach and housing stabilization. While this approach preserves fiscal stability, homelessness is expected to remain near the current baseline of 297 individuals with no significant structural reduction. The second policy alternative under the California Housing Element Law of 1969 is combines regulatory streamlining with interim housing expansion. Zoning amendments would be implemented in the first year to facilitate nonprofit housing development. Interim housing capacity would expand within 2 to 3 years. The projected administrative and capital costs reflect historical implementation patterns observed in comparable California municipalities, undertaking zoning reform and interim housing expansion consistent with multi-year homelessness trend reporting by the United States Department of Housing and Urban Development. This option is projected to reduce homelessness by approximately 5 to 10% or 15 to 30 individuals. Although fiscal exposure remains moderate, long-term impact depends on development timelines and continued municipal oversight. Structural transformation would remain limited compared to permanent housing development. The third alternative prioritizes permanent supportive housing as a structural intervention under the Cranston-Gonzalez National Affordable Housing Act of 1990. Permanent supportive housing integrates affordable units with coordinated supportive services. Capital development estimates are consistent with federal housing benchmarks reported by the United States Department of Housing and Urban Development. In addition, service coordination may align with the California Advanced and Innovating Medical Initiative, or CalAIM, administered by the California Department of Healthcare Services and implemented locally through managed care plans such as Inland Empire Health Plan, which serves San Bernardino County, including the city of Ontario, and supports enhanced care management and community-based stabilization services for high-need population. This approach is projected to reduce homelessness by 25 to 40% um, by 2030. Although capital investment is substantial, this option most directly addresses the structural housing supply imbalance contributing to chronic homelessness. Each alternative was assessed using four criteria: effectiveness, fiscal feasibility, political feasibility, and long term sustainability. The as is alternative ranked high in fiscal feasibility but low in effectiveness and sustainability, indicating that while it preserves budget stability, it does not meaningfully reduce homelessness. Regulatory reform demonstrates moderate performance across categories, offering incremental improvement while maintaining strong fiscal feasibility. Permanent supportive housing ranks highest in effectiveness and sustainability while presenting moderate fiscal exposure and implementation complexity. Based on this structure comparison, permanent supportive housing demonstrates the strongest overall alignment with long-term reduction goals. In conclusion, although recent point in time data reflects measurable improvement, unsheltered homelessness remains a significant municipal concern within the City of Ontario. Continuation of the status quo preserves fiscal stability, and regulatory reform provides incremental improvement. However, permanent supportive housing most directly addresses structural housing instability and demonstrates the strongest long term sustainability. For these reasons, I recommend phased permanent supportive housing expansion as the most evidence-based and strategically aligned approach for achieving sustained reduction in chronic homelessness by 2030. Here are the references utilized for this presentation. Thank you so much for watching.